there. It's 10:05, so let's get started. Good morning, everyone. I am Karen Lamb Church, Director of Community Boards here at Brooklyn Borough Hall, under the leadership of our Borough President Antonio Reynoso. I welcome you to the October 10th, 2023 edition of our Brooklyn Borough Service Cabinet. Today, it's a quick agenda, I think. We have one presentation from the Department of Health, and then we'll move into updates. I'll start with the roll call. CB1.
Here.
Joanna?
Yes, I'm here.
Hi, morning.
Good morning.
CB2.
Good morning, Ms. Church.
Good morning, Ms. Mueller. CB3.
Morning, Beryl here.
Morning. CB4.
Morning, everyone.
CB5. CB6. CB7.
Here.
Good morning, Jeremy. CB8.
Good morning, I'm present.
Hi, Michelle. CB9. CB10.
Good morning, present.
Morning, Josephine. CB11.
Morning, here.
CB12. CB13.
Good morning, present.
Eddie. Hi, CB14. CB15.
Good morning.
Morning, Laura. CB16. CB17. CB18.
CB18 is present.
Good morning. Agencies. Aging.
Good morning,
And I saw
all
Sharice
present.
earlier. Hi. Hi, Sharice.
Hi, Carolyn.
ACS.
Present.
Morning. BPL.
Good morning. Present.
Morning. Michael. CAU.
Good morning, everyone. President Hercules here.
Good morning, Hercules. CCHR. CCRB. See you, but I don't hear you. CC. DCP. DCWP. DDC. DEP.
Good morning, everyone.
Hi, Denise. DOB.
Good morning, Carolyn.
Good morning, Crystal. DOC. DOE. DOF. Department of Health.
Hi there.
Hello.
Hi.
DOT.
Here.
Diana. DSNY. DSS. DYCD. I missed out DPR, Parks. EDC. FDNY. HPD. National Grid. OTI. Emergency Management. NYPD.
Chief Moscow is on for Patrol Borough Brooklyn North, representing Chief Henderson.
Thank you. Oath. SBS. Veterans Affairs. And for some reason, at the end of the list is Con Edison. Last but definitely not least. No one. So good morning. Our last meeting in September was a district managers only meeting. We sent out the minutes of that to the district managers. Are there any changes in those minutes? Okay, so we will put those minutes into the record. Thank you. And I'd like to introduce our team today from the Department of Health. Matthew Montesano, Martha Alexander, Emily Torem, and they'll tell you all about the updated EpiQuery tool and how to navigate it.
Yes, thank you. Good morning. My name is Martha Alexander. I'm working from home today as I recover from COVID, so please excuse the little sniffles. I'm here with my colleagues to tell you about some of the data resources that are available to you. I'm sure you're familiar with some of them. We're constantly being updated, so I hope that this is useful to you. And I will share my screen and let's see. That's you. Okay, so I wanted to start here on the Health Department website so that I can show you all of the resources that are available. Then I'm going to tell you more in depth about the community health profiles, and my colleagues will tell you more about the Environment and Health Data Portal. So this is the Health Department website, nyc.gov/health, which I'm sure you're familiar with. At the top, there's a data tab, so you can click on data. This will take you to the page that is all about New York City health data. Can everyone see this?
Yes.
Cool. Okay, thanks. I'm going to zoom in just a little. So here we are. There are 3 sections to the data page. At the top, you can see interact and visualize, data sets, and publications. So each of the sections has just more links to all of the tools, how we organized it. One of the tools in interact and visualize is EpiQuery, which allows us to analyze and visualize data from our health surveys, from our vital statistics like birth and death certificates, and from disease surveillance reports. I know that's what's on the agenda, wasn't what I want to emphasize today, but I do hope that you'll check out EpiQuery. If you've done some data analysis or have some experience using it, it might be a little easier. You can always email us at query@health.nyc.gov with any questions. But in any case, EpiQuery is like our big sort of powerhouse tool of data resources. If you want to learn more about particular surveys, or if you want to download data sets for analysis, you would click on the data sets tab. And then our publications tab is where you can search for different publications. We have a lot of recent publications, for example, on opioid use, various aspects of health during the COVID-19 pandemic. And so there's a lot of reports here to find. Another special section here is our special reports, which recent reports we've done on the health of Indigenous peoples in the Americas living in New York City, health of Asians and Pacific Islanders in New York City, and health of Latinos in New York City. And those are some very popular reports where we were able to disaggregate for different groups of our community in New York City. So that is an overview. I will go back to interact and visualize, which is where I will link to our profiles, and then you can also get to the Environment and Health Data Portal from there. So the Community Health Profiles tool was developed to show that our health really comes from where we live and work and play in New York City. They help us to get a sense of the challenges and the assets in each community. So this is the homepage of the profiles. And again, from the data tab homepage, you will be able to click to the community health profiles. So there, to enter the profiles, you will either click on a neighborhood on the map or choose a neighborhood from the list. I will choose Brooklyn, East New York. See, I got this error, this pop-up little map, some map details error. You just click that, close it. We're aware of the error. We just have not figured out how to get rid of it. So if you get the error, just click on it. It'll go away and it doesn't affect anything. sorry, so there's step 1, step 2. So step 1 is to choose a district. I chose Brooklyn 5, East New York. And then step 2 is to select a section. If you have seen the community health profiles in the past, they used to be booklets, right? Like PDF booklets or printed booklets. And now we have them completely online, which makes it easier to compare to other neighborhoods, compare to the most neighborhood with the most favorable rate, to see all the neighborhoods in comparison to one another. But I still kind of think of it like the chapters when I'm going into a different section. So when you're looking at the list of sections here that are in the profiles, you can expand some of them where there's a plus sign. So social and economic conditions, under that we'll have an example of what data are in that section. For example, here we have education, economic stress, and some others. So first I will click who we are. This is a good overview page. It just takes a second to come up. In the who we are section, it will cover life expectancy, some demographics of the neighborhood, comparing it to the city overall. Okay, I'll try again. For green. Like we said, it's sort of Monday, right? Let's see, there we go. Okay, I got that little map error again. Okay, so this is the who we are page. And we can see where this community district is on the map, which y'all don't need, but some people will need when they're learning about the city. We have a population estimate for the neighborhood, a self-reported health. You know, this says 90% report that their own health is good, very good, or excellent, which is one measure we use just to sort of think about the health of a district. Life expectancy, percent of residents that were born outside the US, percent of residents that have limited English proficiency. I think these are measures that could be really useful just for overviews of your district. And then comparing this neighborhood to New York City overall, we have the population by age, population breakdown, and then population breakdown by race and ethnicity. So you can see how various neighborhoods compare to the city overall in terms of age distribution and race and ethnicity distribution. On any page within the profiles, you can click the link at the bottom to print or to share the link to the page. You can print just this one page, or you can print the whole profile overall. If you have any questions about that, you can always email us. And you can also, let's see, I wanted to show you how to navigate the different sections. The blue boxes at the top are basically the different sections we were talking about. So if I click on social economic conditions, I'll get to the same neighborhood that we were looking at, but some social economic conditions. This is an example of where we have sort of subsections in a certain chapter. So under social economic, we have information about education, economic stress, neighborhood, violence and incarceration. I want to click on economic stress. We know that overall 18% of New Yorkers live in poverty. Let's see, let's make this a little easier to see here. And so here's the visualization where we can see that Brooklyn is 19%, and then Fort Greene and Brooklyn Heights, 12% live in poverty. The great thing about the profiles is it has all of the sort of analysis in text, like it'll have it in text and then in a visualization. So this will come up. What we can do also is choose a comparison community. So if we want to compare Fort Greene to, say, Greenpoint, you can add a comparison community. See, it adds it to the data visualization. We can also add to show the most favorable rate. So which neighborhood has the best or worst rate of whatever we're looking at. And then that brings in a neighborhood from across the city. So in the end, then we have actually 5 data points in this poverty. So we have the New York City overall, Brooklyn, Greenpoint in Williamsburg, which is the district we added, Fort Greene and Brooklyn Heights, and then the Upper East Side in Manhattan. So this is just one example of how you can sort of manipulate the visualizations within the profiles to find the data that you want. Healthcare is another measure that we look at a lot. So again, we're looking at the blue boxes at the top to navigate. And access to healthcare is one question we ask on the community health survey. So we ask about, were you able to get the healthcare that you needed? And one, let's see, I know that the neighborhood that had the best rate of being able to get healthcare, it's an unmet need. So the neighborhood that had the lowest rate of unmet healthcare needs was Sunset Park. So let's look at that, which means it had the lowest proportion of residents saying that they were not able to get the healthcare they needed. And the way we can know that is, so we see in the text, 7% of adults report going without needed medical care, lower than the rest of New York City. And then here in the visualization, we see that adults without needed medical care was 13% overall in the city, 12% in the borough of Brooklyn, and then 7% in Sunset Park. There's a little plus sign here. In the notes, it says selected community has the most favorable rate. So yay for Sunset Park. This is good news. And that's just one of the data points you can find throughout. And we have another new feature, which I really like. So looking again at the sections across the top, maps, the last box on the right side is maps. And this one makes it easy to see basically any of the data points from throughout the profiles. You can look and see which community districts are the 4 or 5 highest ones and the 4 or 5 lowest ones, and then how each borough measures up. So let's see, if we look at, for example, rent burden, that's another question that is on the, I believe on the community health survey. So we ask, does your rent, is your rent more than 30% of your household income? And then we can see by a map. So the darker colors on the map are, those neighborhoods are more rent burdened. And we see it broken down by the highest percentage, the community districts with the highest percentage of rent burden, lowest percentage of rent burden, and then the rate for each borough. That's how you use the community health profiles. Does anyone have any questions about how to use those or access them?
Ellen, could I ask a quick question?
Of course.
Martha, I'm sorry if I missed this in the beginning. Could you just state when was the data last updated?
We updated the data this year. A lot of the numbers are from the the 2019 and 2020 community health surveys. It takes a little bit of time to clean and analyze the data and then to get it updated into the tool. So, but you'll be able to see, so whatever we're looking at, for example, there will be footnotes on the page and below the data. So you'll be able to see where the source and the year of the data.
Thank you.
Yeah, one of the advantages of putting it in a completely online tool is that we'll be able to update it more kind of as the data are available instead of making a whole new printed document every time. So in this case, you can see under this visualization, we have New York City Bureau of Vital Statistics 2019. Under this one, it's Bureau of Vital Statistics 2017 to 2019. So every visualization will have the data underneath it, like the source. Any other questions? Sure, go ahead. I can't see you guys. Yeah, go ahead.
Jeremy, you're up.
Thank you. I didn't know who was calling, and I didn't know if I was the person you had said should speak.
Oh, sure, yeah,
So
go for it.
I'm from Community Board 7, which includes Sunset Park.
Great.
So that was good news to hear. However, I'm curious if that particular data set is based on specific criteria that is met, or just the feelings of people who take the survey?
That is a question in our community health survey. So it's, did you, sorry, I don't remember the exact wording, but it's like, did you, did you have medical care that you were not able to get?
Medical needs being met. I'm wondering, since about 50% of my population is born outside of the United States, if their medical needs are met based on the health care that they received outside of the United States, and if other communities are actually having communities that with more people who are born in the United States are getting their needs met. It's just people who may not have had healthcare services outside of the country have something basic here, but it's not really all of their needs being met.
Right. I would have to look at the survey questionnaire to see the exact question, but I'm pretty sure it asks about like in the previous 12 months. Most of our health questions that we ask are about like, in the last 12 months, have you had this happen or not happen? So if it were, I guess if it were out of the country in the last 12 months, they might answer regarding that healthcare, but it would generally limited to like more recent.
The way I'm thinking of it is perhaps it's not reaching the same level, but they feel their basic needs are being met.
It's, yeah, I can see how that would be a question either way. Yes.
Hi, Martha.
All right, thank
This is Kanjia.
Yeah.
Okay. Yeah. Hi, I work with Martha at the health department. My name is Kanjia Hinterland. So this is as Martha said, this is a question on our adult survey. The survey is done with more, give or take, about 10,000 New Yorkers, and the data are weighted to be representational. So in that sense, it's representational of the people in the community. I don't know if that speaks to the heart of your concern, but yeah, I would say overall, it's a very general question to just get the pulse of how do people feel about their healthcare needs being met. It is not super specific about whether it's general healthcare or some specific condition. And the other application that Martha didn't talk about, EpiQuery, does sometimes have some of these data from the community health survey and other sources, and you can look at them, stratified by whether people were born in the U.S. or outside the U.S. You can't do that by neighborhood and nativity, but there's a way to kind of look at things a little bit more deeply. So anyway, I don't want to go too far into it. But thanks for your question. It's a great one.
Yes. Yeah, and I'll put my email in the chat so that you're welcome to follow up with more questions. query@health.nyc.gov, because sometimes the question does sort of, I'll be like, we'd have to look at the survey and this and this and this to be absolutely sure of, but in general, I hope that answers the question. Are there any other questions on those tools before I'm sure we'll have time to answer more questions after Emily and Matthew tell us about the Environment and Health Data Portal.
I don't see any additional questions.
Cool. All right, Emily, Matthew.
Hi. Just to introduce ourselves really quickly, I'm Emily, and I'm the Health Content Manager on the Environment and Health Data Portal, which I'll be talking about in a second, and my colleague, Matthew Montesano, if you want to introduce yourself real quick. Jump in.
Hi, folks. Thanks so much for your time and attention today. I'm Matthew Montesano. I'm the Director of Data Communication in our Bureau of Environmental Surveillance and Policy here at the Health Department.
Thank you. Okay, I'm going to share my screen. We're going to do a super quick demo of this tool, if this loads. Okay, awesome. Oops. Okay, can everybody see my screen? Seems like yes. Okay, awesome. Thank you. Okay, so this is another tool for exploring community health. It's the Environment and Health Data Portal. I think Matthew dropped the link in the chat if you'd like to visit it. So you can learn about health issues in your community at the neighborhood level using this tool, and I'm just going to do a quick demo of some of the ways you can do that. So neighborhood reports is a really great way to look at neighborhoods and how they compare to others. I'm just going to put in Bed-Stuy because we're in Brooklyn, and using this, you can take a look at how asthma and the environment, or how asthma is present in Bed-Stuy through different indicators. So you can see here that compared to other neighborhoods, asthma ED visits are actually worse. And if you click on that, you can get some more statistics and measurements about how asthma ED visits kind of show up in this neighborhood. And you can look at bar charts and trend charts and different things and maps to kind of help you learn more about this topic. And if you want to see more about a particular data set, you can click on Get the Data over here, which takes you to our Data Explorer. Kind of similarly, there's a lot of different ways to look at how these indicators show up. You can look at a map. You can look at a trend chart over here. You can even look at how asthma ED visits kind of compare to, for example, adults reporting cockroaches in their home, and kind of look at that trend line over there. And you can explore different indicators related to asthma emergency department visits. Lots and lots of different options over here on the left. You can also kind of get an overview of asthma and environmental health. And then we're also going to take a look at how we look at data in context a little bit more, because data doesn't always tell us the entire story about something. Sometimes we want to learn more about how things are, or why things are the way that they are. So we do that through data stories, which are kind of rich narrative pieces that might explore something like why trash is a public health issue, gives you a little bit of history. It gives you kind of some personal accounts of people who have to deal with this issue and what they're thinking and feeling about it. You know, equity issues are really important to all of our data stories, and we make sure to highlight those. And then there's a lot of resources and different data sets linked throughout, so you can kind of get a really, really comprehensive understanding of that particular issue across different neighborhoods. And then if you are curious about how some of the topics that we talk about kind of spread across data stories, data sets, data features, and other ways, you can always go to our key topics section here. So air quality, for example, we can see here the New York City Community Air Survey, the real-time air quality monitor, which you may be familiar with from the recent wildfire smoke events. You can also navigate data stories related to air quality and environmental health, data sets, neighborhood reports, and everything we have on that topic. And at kind of a higher level, we have climate and health, housing, inequality and health inequities, active transit and design, and lots more. And then if you are curious about updates in terms of new content and features, and maybe even are interested in participating in user research, you can always go to our homepage and you can sign up here, put your email down, super simple, and we will send you very, very periodic updates. I would say like maybe once a month or so. And that is kind of it. Does anyone have any questions?
I don't see any questions, Emily.
Okay. Well, thank you so much.
Is there another part to the presentation?
That's it.
No, we just, oh, sorry. Yeah, no.
You're done. Well, I think that this was great. It's definitely a way for us to get the information in a more dynamic state and to be able to use it, especially when we do the health portion of our community district needs statement. I loved when we started doing the community health profiles, and this is just another way up. Just one question on the environmental side. It's set up by zip code. Is there a layer that can bring it up by community board district?
Hi, this is Matthew. That's a great question. So there are some data sets on the Environment and Health Data Portal that are available by community district. But in the neighborhood reports, a lot of those data sets are available by another neighborhood arrangement called UHF 42, which doesn't line up with community districts super well. So unfortunately, that's a little bit of a limitation of the data sets for your needs.
Thank you. Melinda? Melinda? She put her hand down. Maybe that was an error. Anyone has any questions for DOH? Okay. Hearing none.
Thanks, everyone.
Hello?
Thank you.
Yeah, I want to thank Emily, Martha, and Matthew for coming today to show us this really amazing tool. I think for Brooklyn Community Boards, it's just another tool, sorry to use that word again, in our box when we look at our districts and try to make the best possible decisions for them. So thank you very, very much for coming today. And if anyone asks any questions later, I can forward those to you if you don't have your contact information in the chat. Okay, so Melinda's audio isn't working. She'll submit her questions via email. So thank you to the Department of Health. And while you're here, before you go, since you already have the floor, do you have any updates from the agency you'd like to bring? Matthew, Martha?
No, we don't. Thank you, though.
Thank you.
Hey, you're welcome. All right, so with that, we will move into service cabinet updates. I'll start with the agencies today. Who has an update?
Hi, Carol Ann.
Hey, Cherise.
Hi. So for everybody on the call, well, especially for those who've been around for a long time, it's not new to you that the Department for the Aging hosts public hearings around this time of year, every year in every borough. And actually today's public hearing is in Staten Island. So of course, since I represent Brooklyn and this is about Brooklyn, I want everyone to know that on Wednesday, October 25th, is the Brooklyn public hearing. It's the annual plan summary hearing. We invite our elected officials, our community boards, stakeholders, older adults to come out and to comment on the agency's annual plan summary. I tried to drop that in the chat, but I don't think the hyperlink is there, but I have emailed the district managers to inform. If you haven't received anything from me, by all means, let me know. It's on Wednesday, as I said, the 25th from 10 until noon at the Park Slope Center for Successful Aging, 463A, 7th Street. I know in the past, Sean has come out, Jeremy's come out. I don't want to continue naming names, but I just know that there has been interest among our district managers, and I would just encourage you to blast this information. We want to have a nice full house, a robust attendance, and we want people to let the Department for the Aging know what services, which programs they'd like to see us continue to promote and develop, what's working, what's not working. But the document itself is on the website and should be in your emails that I sent out. But you can always go to the Department for the Aging, to the website and look for it under publications or reports. And it's the annual plan summary hearing.
Thank you so much, Sharice.
You're welcome.
Venus? Yes.
Hi, everyone. I'm Venus Canterbury. I'm the Brooklyn Outreach Coordinator for the New York City Civil Complaint Review Board. It's great to see everyone. I'll be really brief. We are a city agency that independently investigates, mediates, and prosecutes allegations of police misconduct. Our jurisdiction is excessive force, abuse of authority, discourtesy, offensive language, and we just recently added untruthful statements. You can file online, you can file at our hotline. I'll list all of that information. You can also direct message us on social medias. We have a upcoming board meeting / town hall tomorrow. It will be in-house at our office, 400 Church Street, Lower Manhattan. You can also access it via WebEx. I'll put the link in the chat. You will be hearing lots of updates. It will be a community forum where folks can voice what the agency can do better at improving police and community relations. So I hope that I can see some familiar faces at the meeting tomorrow. But thank you, everyone, and have a great rest of your day.
Thank you, Venus. So I see before we continue, we have some cabinet members who joined after the roll call. Can you please introduce yourselves?
Sherry Fraser, District Manager, Community Board 17. Sorry to be late. I'm the only one in office. I've been a little busy. Thank you.
Thank you, Sharif. I saw folks from agencies.
Hi, good morning. Yuri Sanchez, DSS.
Thank you, Yuri. Olanike Alabi. Ola. Okay. I don't know what agency she's from. And also on the call are some of my colleagues, David Bourgois, Hassan Chaudhary, and some of you may know Lacey Toba. Any other updates? Celeste.
Yes. Hello, everyone. Is this the time for district manager updates, Caroline?
Everyone, come on
Okay.
in.
All right. Just want to make sure. So I just wanted to note to folks, I know that the deadline for the Fund for the City of New York fellow applications just passed the end of September. Yep. I submitted one project. I was inspired by a conversation that we had. A few of us went to Detroit recently, spoke with some city officials there, and it was in reference to 311. So I just wanted to share with everyone in this forum. The project is going to be looking at gaps between agency responses that are unsatisfactory. So whether it's closed out, whether the issue was unfounded at the time of inspection, and it's potentially going to see if there's any way that the community board can assist with those types of, if it's a chronic issue or recurring issue in certain areas. But I just wanted to flag that. So it's a little bit of a comparative analysis for 311. Whenever you see issues that are frequently unfounded or closed out or just, not able to gain access. So that could be a variety of agencies, but we welcome a robust conversation about how we can better address some of those service delivery issues and understand the agency's process, because we know 311 is just the filter, right? Each agency has their own internal complaint process, and we look forward to learning a little bit more about that. That's all for me.
Thank you. Hi, Crystal.
Good morning, everyone. I am Crystal Jallo from Department of Buildings, Community Engagement for Brooklyn Community Board 6, 7, 8, 10, and 11. With that being said, I have a few announcements. The building after hours
effective October has been reduced to the first and third Tuesday of each month, between 4 and 7. So it would be the first and third Tuesday of the month, and it will no longer be every Tuesday. Another announcement is Local Law 163 of 2021. Artwork will be required on temporary protective structures, and they have to submit a PW1, an application for that. Another announcement is the periodic gas piping system inspections, known as Local Law 152 of 2016. It's starting by the end of this year. Community boards 2, 5, 7, 13, and 18 in all boroughs should have submit their inspection. So again, by the end of this year, by December 31st, sorry, of this year's, excuse me, I'm sorry, I mentioned the wrong boards. It's 11, 12, 14, 15, and 17. Again, 11, 12, 14, 15, 17 in all boroughs. Starting 2024, CB 1, 3, and 10 in all boroughs will be required to submit that inspection. And I think that is all for me.
Thank you, Crystal.
Thank you.
Mike, BPL?
Hi, good morning. I just threw some links in the chat. October is Banned Books Week, or October starts with Banned Book Week, and a lot of book banning across the country affects teens. So BPL is working with PEN America to launch a teen advocacy institute that teens in New York, but also across the country, can learn about what they can do to stop book banning and to promote the intellectual freedom. And that starts October 19th. So I put the link in the chat to that. Also put the link in the chat to our borough-wide Hispanic Heritage Month events. And one of my favorite programs at the library is Ready, Set, Kindergarten, which is for 3 to 5-year-olds to get ready for kindergarten, or to help those that are just starting adjust to kindergarten. And there's some programs happening around the borough, and it's also happening virtually. So parents or caregivers can attend with their children and get as ready for kindergarten as possible. Otherwise, it's so nice to see everyone, and I'm looking forward to hearing everyone else's updates.
Thank you, Michael. Anyone has any other updates? Eddie.
Hi guys. I just wanted to mention to the other DMs, if they weren't already notified by the Office of Cannabis Management, that they're having workshops today and Thursday night about the open registration between the next 2 months, October, November, and December. I don't know about you guys, but we got 2 licensing already asking for our recommendation. I just wanted to see if any DMs got any in their backyards yet, because it's open registration, not for the incarcerated, but for everybody now. So I just want to see if any of the other DMs gotten any applications into their backyards.
Quite a few.
Quite a few? Okay, so it wasn't just me then. All right, 2. Yeah, somebody said that they had like 13 in Manhattan already, and I'm like, what?
We have over 20 here at Community Board 1.
Oh, was it? Okay, yeah. It just, and I wasn't sure if we do anything except for just give our recommendation, which means nothing. I know, it's like, so I'm just wondering, what else can we do, because they're having the workshop right now as we're having our workshop here, our meeting today. So I guess I'll get my information from my other staff to see what's happening. But I just want to give you guys an update.
Thanks, Eddie.
CB3 has gotten 5 already, and no one from the Cannabis Commission has reached out to us to let us know what our process sees out. So it's crazy.
Jeremy? Thank you, Vera.
So we're figuring out our process Thursday night for our first 2 applications. We're going to handle them pretty much the way we handle liquor license applications. And I'm sure they will be treated with as much respect by the state as the liquor licenses. Off this topic, I wanted to bring up restaurant use of streets, the open street, not open streets, open restaurants program, I think it is. The city just passed a law, I think since the last time we met. There will be some requirements of community boards. I don't know what those are yet. I haven't received any training or even any briefing. I thought perhaps that might be a good topic for an upcoming borough service cabinet for us to learn more about that process.
Noted, Jeremy. Is Diana still on? I'm wanting to put you on the spot, but do you know anything? Guess not. Moving along, does anyone else have anything? Ija?
Yes, good morning, everyone. Fighting a slight cold. Just want to remind everyone that November 1st opens up the regular HEAP season. And if customers apply for HEAP, they can automatically be enrolled in the National Grid Energy Affordability Monthly Discount Program. And although the Neighborhood Heating Fund is closed now, it will reopen in February, where customers can get an additional $200 if they receive HEAP. And our moderate programs are still open, so they can still apply for that. And we do have a lot of energy efficiency programs, and we just encourage customers to have their gas safety inspection if they haven't done that yet. And they can always reach out to us for further information about our National Grid programs and also programs at the state and federal level. And thank you, and good to see everybody again.
Thank you. To all the agencies who have updates that sort of require action, like Krista, local law 152 and 163, Venus about the workshops, can you please also forward whatever social media assets you may have or flyers to the community boards, or you can send it to me, I can send it to them so that they can get this information out to their constituents. Deputy Chief, do you have anything for us today?
Yes, good morning. My name is Deputy Chief Raphael Moscol. I'm the Executive Officer of Patrol Borough Brooklyn North, covering the 10 precincts in the north side of Brooklyn, 7573, 77, 79, 81, 83, 84, 90, and 94. Just giving you a quick report about as far as crime is concerned. We are down in crime across the board. 6 out of the 7 major indexes of crime. We are just struggling with felony assaults at this time, led mainly by domestic assaults. And assaults on police officers is up this year, also driving that number up. We've seen an incredible decrease in shootings this year, down 71 incidents for the year. And that amounts to about 88 less people, that were injured by gunfire this year. A couple commands are struggling with incidents of shoplifting in the 8-4 precinct along the Abbey Square Mall. We see some shopliftings, and year to date we have issues with some serial individuals going at knife point, going into our stores in the East New York area. We've identified a couple individuals, and we are hoping to make some apprehensions in the very near future of these individuals. Also, we've seen a rash of scooter-involved incidents where either the scooter is being robbed at knife or gunpoint, or they're using the scooters in commissions of crimes like chain snatching or just strong arm robberies. That's it's usually 2 individuals on the scooter. They roll up to the individual, either come out with a gun or a knife point, and they either take the person's scooter or they take items from that person. So those are the two areas where we are fighting here, in the month of October, and hopefully we'll be making some apprehensions of these individuals in the near future. I also have to give a warning, out to all the community boards, alerting the seniors of a scam that's pretty, robust scan across the entire city of New York and even going into upstate Connecticut and upstate New York itself, where they target seniors 65, 62 and older. They go into Citibank and Chase Bank, and they distract them by either saying, hey, you drop $10, drop $20 on the ground. When they do, they switch their debit cards with a bogus debit card. And then, they have like 2 or 3 lookouts that look over the shoulder of the seniors to get the PIN number. Once they switch the debit card, the senior goes into the bank to say, complain about the debit card, and they go into their senior's account with the senior's debit card and their PIN number and remove, hundreds of dollars, thousands of dollars in many instances from the seniors. We have several, crews that are involved in this, this crime. And as I said, throughout the entire city, and we've seen them going upstate. We made a couple apprehensions, but it is a large crew. And they've been hitting. So please get that word out to our seniors about people close to them over their shoulders or even being distracted. Do not, turn away from the machine if they're taking money out. Concentrate on the machine, get their money out, and then leave without, being helped by anyone that's in there. If they need any help, let them go into the bank itself and ask for the manager for help.
Thank you, Chief. There's a question in the chat from Melinda, District Manager CB5. Her audio isn't working.
Mm-hmm.
And this is in reference to probably stores being held up at knife point. I'm not sure. Is this mostly in the Gateway Center area of the East New York 75th Precinct?
Now it's more towards the border of the 102 precinct and the 75 precinct and the 75 precinct in the northern end of the 75 precinct area. They've hit Papa John's a couple times, Taco Bell, and what's called in the Gateway Mall. We see more of the shoplifting where the individuals, 2, 3 individuals go in there at one time and just fill their bags up with stuff and then walk out. We made several apprehensions in regard to that. We had a crew of young folks between the ages of 17 and 19 that were hitting the Gateway Malls stores. We were able to apprehend those individuals, and that kind of slowed that down significantly. But no, the one I'm talking about where the individuals are hitting the 108 precinct, the 102 precinct, and now they've hit the 75 precinct is on that border between the 75 and the 102 precinct.
Thank you. Cherise?
Yes, hi. Deputy Chief Musco. How are you?
Hey, nice to see you again.
The scam that you just mentioned, is this something we can find on the NYPD site or on the DA's website? How can we get this information in some kind of format that can be disseminated?
Our crime prevention have put it out.
Crime prevention team?
Yeah, and it also has been put out on Twitter because I said it has been going on since last November. It's just taking off. We saw a major increase in the first 3 months of the year. Then it kind of fed off because we apprehended a couple individuals, and now in the last I would say the last month and a half, we've just seen a rash of it again. We don't get hit as much, which is not saying that's a good thing or bad thing. That's just we don't want it at all. We've had 4 in the last month in the 8-4, 9-0, and 9-4. So it is creeping back up in our area. We've tried to work with Chase and Citibank. Those are the 2 main banks that they've hit. And for some reason, I think they just have copies of the Chase Bank and the Citibank cards that they can use to distract our seniors. But those are the 2 main banks that they do target. And we work with them to try to get that message with signs about being distracted. But yeah, our website, does have it, I will pass it on to you and get you that information.
Thank you. Thank you very much.
Thank you. Okay, Melinda had another question, but it seemed that it got answered in your response to Sharice. So are those all the questions for the Deputy Chief? Seems like it. Thank you, Deputy Chief Maskell.
You're welcome.
Any other updates? No, none? Okay. So we'll move into older business. I just want to follow up on a request from the last cabinet meeting for a session on the migrant crisis. I've already reached out to the agencies. Please, as soon as you have your questions, don't wait until the last minute to send them in. I'm going on vacation. I'd love to get those questions in before I leave, so that the agencies know what they're coming in to discuss and can provide great answers for productive meeting. So please get those questions to me. Would appreciate if I can get them, say, next Monday would be great, because it gives me time to follow up with the agencies before I leave. Also, future meetings, apart from that one, while I have had some agencies reach out to be on the agenda, if the DMs have any agenda items that they'd like for us to put together to facilitate, please let me know what those topics are. And for the DM meeting with Borough Hall staff, it doesn't seem possible that I can get everyone in the same room at the same time. So we're going to go with where we get the most people. Just wanted to put that out there. Does anyone else have anything under old business? No. Okay, good. New business. Any new business? Although I think we sort of hit on something earlier, but anything anyone wants to bring up for us to consider? Nope. Okay. Well, that brings us to what is most people's favorite item on any agenda: adjournment. Thank you so much for your time today, and I will see you on November 14th. Don't forget to vote.
Thank you,
Thank
everyone.
you.
Have a good day.
Have a good
Bye-bye.
day.
Bye.
Thank you.
Have a good day.
Thank you.
Beautiful hairstyle. Thank you.
Thank you, Sharif.
You're welcome. Have a good day.
You too.